Thank you so much, Philip, for this kind introduction, and also just thank you to the working group on environment of the special interest group for inviting me to be the first speaker of this lunch talk series that I'm very excited about. And I would like to talk to you today a little bit about why environmental issues are also health issues, and why health psychologists hopefully should start caring more about this. It's a good time for this topic because a lot of articles are coming out, preprints are coming out as we speak about this topic. So it's great that this is gaining momentum, I think. So I think I have two key messages for this talk. And one is that we should really understand or build a systemic view of environmental health in psychology. And we should also recognize that as psychologists, we have a lot to contribute to environmental health issues. All right, so just briefly to remind everyone what kind of environmental issues are we facing today. Obviously, climate change as one of the biggest threats to human life on the planet at the moment. It has both direct and indirect effects on human health. For example, direct effects include extreme weather, such as droughts or flooding, but also effects on mental health, such as eco-anxiety. It also has indirect effects on human health, such as vector-borne diseases that vectors can thrive in the new climate, such as mosquitoes. There is but also food insecurity or increased armed conflict that we can expect. Besides climate change, there are many other environmental issues that we should care about. For example, chemical pollution of water and soil is a big issue. It has multiple health effects that are likely even underestimated. And then, of course, there's the burning of fossil fuel. And you see, of course, this is all interconnected because burning of fossil fuels and greenhouse gas emissions is one of the key contributors to climate change again. Recently, the concept of planetary health has been suggested that kind of more appropriately or more prominently maybe links environmental issues and health issues, because what I tried to highlight also with the images I added to this slide is that very often, in my opinion, environmental scientists communicate about environmental issues using images of the environment. However, and I think this is reflected well in the planetary health concept, it is about the people. It is about us humans who will not thrive in a new climate. So we are in a very fragile state living on the earth, and we therefore need to really manage the earth in a way that is conducive to human life. More broadly, even then, I believe the concept of planetary health to me is the concept of environmental health, and it's actually much older than the planetary health concept. Environmental health is broader in the sense that it includes any kind of public health issue that includes the impact of people on their environment, but also the impact of the environment on people. So it's beyond climate change. It's about using sustainable resources. It's about clean water and safe sanitation. And it's about issues such as noise pollution, for example. So whether they are anthropogenic, man-made, or otherwise influencing our health and well-being. And what my colleagues and I propose is that we should consider this environmental health more in health psychology. And the reason for this is that human behavior is key in many of these issues. For example, 26% of energy consumed in the EU has been estimated to be used by households or individuals. But also beyond individuals, human behavior is also present, of course, in organizations, industrial behavior that consumes a lot of energy resources and emits greenhouse gas emissions. So how about environment and health in psychology? And traditionally, we have two subdisciplines that separately are concerned with each of these topics. So we have health psychology, of course, everyone here very familiar with this, for example, concerned with promoting healthy behaviors to prevent diseases or facilitate rehabilitation. Typically, this includes physical activity or healthy eating or substance abuse. And then we have environmental psychology, and typically they are concerned with protecting the environment, so pro-environmental behavior. There are other branches of environmental psychology too, but in terms of environmental protection, they are interested in recycling, for example, avoiding littering, energy consumption, etc. So my colleagues and I try to integrate these views to kind of establish a systemic view of environmental health also in psychology, as it is already being done in public health. And we try to visualize this, how this interconnectedness with this graph. So of course, we have people, we have the environment, and they are linked, and human health is dependent both on the person, but also on the environment. And so is the environment. So to make it simple, we propose that we might be talking about mitigation behaviors when we are thinking of behaviors by people or groups or organizations that impact the environment. And on the other hand, we could call adaptation behaviors, how humans react to adverse impacts of the environment. So traditionally, these behaviors might be labeled as health behaviors or pro-environmental behaviors, but to avoid thinking about these subdisciplines, we propose perhaps a different terminology. So what are mitigation behaviors? As I said, it's the impact of a person on the environment. So you could think of pro-environmental behaviors such as adopting solar power, for example, but then also behaviors such as active commuting instead of using the car, which is a huge influence to stop climate change. Then decreasing meat consumption, such as vegetarian or vegan diet, but also other issues such as avoiding pesticide use to avoid contaminating the environment. And what's interesting about these behaviors in our view is that many of them also have co-benefits. And co-benefits is a term coined by Bain and colleagues, which means that a lot of these behaviors, they can both benefit the individual's health or societal health, but also the planet's health or the environmental health. And from this follows also that we might leverage this more, and linking back to the imagery that I used in the beginning, that we might focus more on health issues or health benefits of these behaviors rather than pro-environmental benefits, for at least for some people. On the other hand, we have adaptation behaviors, and these behaviors are traditionally, I would say, we could and should consider them health behaviors, but they have not been typically studied in health psychology. I really like this categorization by Van Valkengoed and Stech. So they categorized adaptation behaviors into information seeking, which might include behaviors such as monitoring our environment, or preparative action. So when we already know an environmental risk is present, we can take preventive action to not be at risk of this factor, for example, flood-proofing our home. And in the end, when we are really at risk, we can take protective action such as wearing face masks or respirators, or using a mosquito net and other things like that. And yeah, what we advocate for is really to, as health psychologists, we can contribute a lot to understanding these adaptation behaviors as well as the behaviors that we have traditionally perhaps studied. And it will be really important that we engage more and apply our knowledge, our theories and approaches to these behaviors as well. So overall, how can we as health psychologists contribute? Well, in our view, or in my view, one key thing that we can contribute is, of course, understanding behavior. So we have a lot of theories and methods that allow us to describe which behaviors might be problematic, how we should change behavior in a more favorable way. And then, of course, the predictors of behaviors, the determinants. We have a lot of very good theories, I think, that can help us with that as well. And second, we also have developed systematic approaches to change behavior based on this knowledge. One of the prominent approaches, of course, the behavior change wheel by Mickey and colleagues, but also other approaches that help us systematically develop interventions and evaluating them. And for example, this is something that I think we can also contribute in addition to public health scientists, who often do not necessarily base their interventions on theories of behavior change. And the third point I already alluded to, I think, is we need to recognize the double role of health behaviors. So they can be both beneficial for personal health, but they can also be beneficial for the environment. And another aspect that has been emphasized by recent publications is also that we must think, how will climate change or other environmental issues potentially impact on these health behaviors and exacerbate any kind of risk factors that we are already facing, such as that in a warmer climate, for example, we might not be able to be physically active like we used to be. And then lastly, beyond these, what I say, classic health behaviors, I believe we should broaden our understanding what health behavior is. In general, health behavior includes a behavior that protects or promotes one's health. And so if we are thinking about environmental health, there are a lot of behaviors that we haven't studied yet in health psychology, but that are really important, such as water and sanitation behavior, pesticide use, but also issues of indoor pollution, air pollution, and many more. So to illustrate this a little bit, I brought with me two examples from our own research group, how we are studying environmental health in psychology. And the first example dates back to my dissertation, actually, and it's about drinking water contamination. And this, along our figure that we propose, would be under the adaptation behaviors. So many people worldwide are facing risks of contaminated drinking water, which has a lot of adverse health effects. They can be immediate, such as diarrhea, which is one of the leading causes of death for children under 5 years. But they can also be leading to chronic diseases such as cancer. One example from my work is drinking water contaminated with arsenic. It's estimated that about 200 million people drink arsenic contaminated water, roughly, and you can find arsenic contamination in many areas of the world, and it is what is called geogenic. So that means it's not made by us, but it really appears in the Earth's crust. It's a natural contaminant, but when ingested, it can adversely affect health. Maybe you know arsenic as the poison that was apparently used to murder the husband slowly by putting arsenic in their food or something like that. But yeah, as I said, it also naturally occurs. And unfortunately, the ingestion of arsenic can lead to arsenicosis, which is a chronic disease where arsenic accumulates in the body. And you can see some of the health effects that are part of arsenicosis. So there are some hardenings of the skin, but also of the feet, which can then also decrease function, even working, and decrease livelihoods of people, but then also can lead to cancers, for example, of the bladder and the lung. And one of the most severely affected countries by arsenic in the world is Bangladesh. And it's been estimated that around 24,000 deaths in Bangladesh alone are attributed to arsenic consumption through drinking water. Yeah, so this finding in the 1990s was led to a lot of work that is being done in Bangladesh, a lot of science as well that is trying to find ways how to filter arsenic from the drinking water. And finally, a lot of the wells that are used traditionally in Bangladesh for drinking water provision, they were tested, and those that were found arsenic contaminated, they were painted red. And where no other safe water sources were available, new affordable water sources were distributed and installed. However, many of these water resources are not being used, or they are not being maintained. So just to highlight that here again, our health psychological approaches might be helpful to understand this, because the interventions that exist to promote behavior change in this context, they were lacking control groups, they were not theory-based, and as we know, they had poor intervention descriptions, which is a common problem hampering the science of behavior change. So what we did as a first step was we interviewed roughly 800 households who had access to one of these arsenic safe water sources. These could include, for example, tanks that were installed to collect rainwater, sharing wells with neighbors who had safe wells, but also piped water supply in rural areas that were available in some areas. And we interviewed, using a theoretical framework called the Uranus approach, we interviewed these households regarding their self-efficacy to use these different safe water sources, their injunctive norm, for example. And we identified that one big reason to not use many of these sources was that it takes more time, because people have to walk greater distances to collect their drinking water. And we also found in a later modeling study that commitment, or a lack of commitment to put in this extra time to collect water from this remote source, was one reason why people refrained from doing so. And so we developed an intervention based on the psychological findings to promote the use of existing safe water sources. These include techniques that you know, behavior change techniques such as implementation intentions, or also reminders that were installed where people collected water from, to remind them what this water can be or shall not be used for. And in a second intervention phase, we also planned together with participants to overcome barriers that they encountered while trying to switch to safe water sources. And here are now the results from two cluster randomized trials that we conducted in Bangladesh. And you see on the x-axis different time points. So T1 was our baseline time point, and we only included people who at baseline were not already drinking water from the safe water sources. So these were really like the people who had actually decided against going the extra mile to use these. And then we implemented the interventions, and I'll show you the effects on the number of users of the available safe water sources on the y-axis. And as you can see, so in our comparison group, we had information only, which is kind of like the standard intervention in an area like Bangladesh, where people are informed about the health effects of arsenic consumption, and then adding even simple reminders, but then also adding implementation intentions, this dark gray bar, really ramped up the behavior change. And this remained more or less stable over a 2-month period, and then declined somewhat up to the 9-month follow-up, but we still had quite significant effects and around 40% greater safe water consumption than in the control group. And this was also verified by water sample testing of people's drinking water. So I think I tried to highlight that this is that the psychological aspects of these reactions to environmental contaminants are really important to look at and are giving us very promising levers to promote health behavior change. And another example is from my colleague Alexandra Huber. From her dissertation, she was working on fluoride contaminated drinking water in Ethiopia. And they developed, together with engineers at EAWAG, a very low-cost solution using bone char filters of drinking water that effectively filters the fluoride. And what's interesting about her study is that she found that people in Ethiopia were required to pay for this safe water. In turn, the other water was much cheaper or even for free. And they really had, or the researchers found that people really had this perception that the drinking water will be much too expensive and they would not be able to afford it. And so what they did in their intervention is they intervened on the perceived costs. So the actual cost of the safe water did not change. It was not further subsidized, but they did a kind of household budget calculation with householders and also tried to enhance their commitment to invest in the safe water. And they were actually successful, as you can see, to decrease this perceived cost, even though the actual cost had not changed, and also achieved a greater adoption of the safe water source there. So to me, this is also another example where we can see that a health psychology or a psychological view on these issues might be really beneficial to promote health behavior change. Another example that I'd like to introduce you to is about pesticide handling. I believe that's also a topic that health psychologists have not traditionally tackled. It's also an interesting example because it includes pesticide handling, includes both adaptation behavior. So how can workers protect themselves or farmers protect themselves from the adverse health effects of pesticides? But on the other hand, also how can they mitigate the effects of applying pesticides on their environment, which might include maybe switching to organic farming techniques, but also maybe spraying in a way or disposing of pesticide wastes in more sustainable ways. And yeah, so obviously pesticides are used worldwide to intensify food production. And yeah, they unfortunately have negative effects for the environment. So here in Europe, for example, a lot of pesticides are also forbidden, but we find them still a lot in low and middle income countries, where we of course also get a lot of our produce from. In addition, pesticides have known and unknown health effects, adverse health effects, yeah, including acute poisoning, but then also chronic effects. It can even affect mental health. It is very yeah, sickening for women who are pregnant, etc., etc. And yeah, what one observes is that most farmers, especially in the global south, do not protect themselves sufficiently while applying pesticides. So you can see this person in our study in Uganda on the lower half of this slide. He's mixing the pesticides, so breathing in the fumes that are emanating from there. He has no protective equipment on his arms. He's wearing an overall, but he has no mask or anything that would protect him from these health effects. And in addition, and you see this on the top half, we often see that pesticides are not disposed of properly. They can contaminate the drinking water here. Also because there is a lack of places where people can recycle pesticide containers. So in this project, this was a large interdisciplinary project where epidemiologists also quantified the health effects and environmental scientists quantified the environmental burden of pesticide use. And we, with our team, joined this project to understand what are actually the psychological determinants that might explain why people are protecting themselves or the environment in terms of their pesticide handling. And we conducted this study in Uganda, in Africa. And one part of the study was behavioral observation. So my student, Nicola Diemer, she visited different farms in our study area, and she did a structured observation of what is actually pesticide handling. So we found surprisingly little knowledge prior to our study on what we might understand under pesticide handling, and which of these behaviors might be most important to tackle in terms of health effects. So as you can see, we found several environment-related behaviors, such as spraying close to a water source, which might contaminate it, but also pouring leftovers into the bush. And then, we found that basically none of the observed workers were using full protective equipment, especially people were barehanded or barefoot and wearing short sleeves, which is also perfectly understandable in the climate. And but there are also other dangers, such as endangering other people in the home because pesticides were stored near children or in the family home, etc. And we did a first qualitative study where we wanted to find out how do farmers even get information about pesticides, about this complex topic. And we found out that farmers are interested to seek information about pesticides and alternative farming techniques when they get some kind of disruptive information, for example, an event from outside, or when they would like to start a new farming practice, such as a new crop. And they predominantly seek information within their community, which is also one reason why information on the latest trends in organic farming, for example, might not be available locally because nobody is yet doing that in the community. And then whether such information is used and adopted, it also depends on whether the source that conveys that information is credible. And in the second part of the study, we did a quantitative assessment using a health behavior change theory called the RANAS model. The RANAS model is a framework model, maybe a bit similar to the behavior change wheel. It was developed in 2012. And it also, I think it features a nice integration already of some of the factors that we know are important from environmental psychology, but also from health psychology. And so in this quantitative survey, we tried to investigate which of these behavioral determinants might explain why farmers are protecting themselves more or less, and why they are taking better or lesser care of the environment with their pesticide handling. Well, first we replicated our findings from the qualitative study that a lot of the farmers were not using adequate protection for their own personal health while applying pesticides. And our regression analysis of the different potential behavioral determinants revealed that farmers wore protective equipment more frequently if they perceived a greater risk, if they had more knowledge of what protective equipment to use and where to find this, and also who are more committed to investing in protective equipment and who have a higher socioeconomic status, maybe indicating also the possibility to purchase these items. On the other hand, in terms of mitigation behavior, we focused on the container disposal because it can really adversely impact water bodies and soil. And we found that most of the containers here were burned or just left in the garden or on the farm grounds, contaminating the soil and the air. And because no safe disposal sites were available in our study areas, we focused on perhaps establishing triple rinsing, which is a method by which empty containers of pesticides can be washed out in a safe way and then disposed of in a safe way, also so that no children can access these, and so that they don't lie around in the field and can be burned safely. But we found that hardly anybody of our study knew about triple rinsing. So we did a regression analysis to explain the intention to perhaps adopt this triple rinsing method. And we identified people's personal norm and their self-efficacy as important potential drivers for perhaps an intervention to promote this. So this was focusing more on the farmers' individual behavior, but we are continuing this work on pesticides also in a collaboration with political scientists. And together with PhD student Ruth Wiedemann, we are investigating whether policies in place to regulate this pesticide handling are actually tackling the behavioral determinants that, that we identified or others have identified as important determinants of safe pesticide handling. And we want to see whether maybe those policies that tackle more specific behavioral determinants will be more effective in promoting pesticide handling. So with these two examples, what can we conclude? So how can health psychology contribute to understanding and promoting environmental health? Well, I hope I illustrated this a little bit with my examples. There are, of course, many other examples out there and really exciting studies being conducted at the moment in this field. Overall, I really advocate that we should tackle environmental health as a systemic issue in health psychology. Our colleagues in public health are doing this already, but I think health psychology can contribute unique knowledge because we know about behavior change. So to build a cumulative science of behavior change, I believe, and my colleagues and I are advocating that we should integrate different behavior change theories as it's already being done, for example, in the behavior change wheel. So rather than thinking about environmental behaviors and health behaviors separately, we really think we can push this field by having a more systemic view on environmental health. Of course, to do this, we also need to collaborate with others, and it's obvious that we have to collaborate with other disciplines, I think, but maybe, yeah, somehow less often done is also to collaborate with other subdisciplines in psychology. So while writing this paper, we had a nice collaboration with environmental and health psychology, and I think we all learned a lot in the process. So yeah, I think it would be very fruitful to do this more. This also requires maybe that we go to each other's conferences or that we publish in joint publications in each other's journals. And maybe we need new journals that will tackle environmental health psychology as well. And third, I think it's really important that as health psychologists, we broaden our understanding of what is health behavior and also how is health behavior impacted by the environment. So we, in short, we need to take environment more into account in health psychology. I think that would really help us to understand and tackle environmental health. So to conclude, yeah, environmental issues are health issues, and it's about the people. And I try to symbolize this with the image here, rather than only showing the environment or only the person. It's really a blended issue. And yeah, it sounds simple, but I believe one conclusion from this is even to maybe use this more as a lever to promote environmental health. So really to mitigate environmental effects of humans, but also to adapt or promote adaptation to environmental issues. And most importantly, also it's possible that different people are motivated by different motives, such as in our article, we suggest that maybe younger people are more motivated by pro-environmental motives, whereas maybe other people are more motivated by health motives. So because it's all about the people, from my perspective, it's psychology has a lot to contribute, and I really hope to have inspired some of you also to work more in this field. I'd like to really express a big gratitude to my co-authors. A lot of what I've been talking about today is part of our latest publication forthcoming in European Psychologist. This was really a lovely collaboration, and yeah, thank you so much to everybody who was involved, and thank you so much for listening. I'm looking forward to discussing with you.